Are you stuck with H.A.Robert's philosophies? Then don't worry, I got you. Today we're going to learn about chapter Palliation in H.A.Robert's philosophy. So what do you know about palliation? Palliation means giving temporary relief to symptoms, especially in incurable cases, without removing the root cause. So there are certain diseases that is not curable, isn't it? One of the example is cancer. So in such cases, we cannot see the person suffering for a long period of time. So even though we are not able to remove the root cause of the disease, we will be able to give some kind of relief, and that some kind of relief is called as palliation. So palliation means giving temporary relief to symptoms, especially in incurable cases, without removing the root cause. So instead of saying all of sentence, we will say one single word, that's palliation. So in allopathy, this is often done using painkillers, sedatives or narcotics, which mask the suffering but suppress the expression of the disease, making the real cure impossible and even harming the patient more. So we know sometimes the people will be thinking, okay, when I give this sedatives or painkillers, the person is having a temporary relief. But that kind of temporary relief can lead to another kind of disease, and that disease will be more dangerous. So instead of that, what we have to do? We shouldn't harm the patient more. So even in incurable cases, the law of similar must be used, not narcotics. So what does it teach? Instead of narcotics or painkillers or sedatives, what we should do? We should bring our laws of similars. And because only similar remedies can give natural, gentle and true relief without damaging the patient further. So instead of giving more dangerous disease or suppressing the symptom, what we are giving? We are removing the root cause. We are removing the real disease slowly and temporarily, giving a relief to the patient. So let's break it down in sections. What does H.A.Robert say about this? So confusion in incurable cases. So first we will be confused in incurable cases. Even homeopaths sometimes panic in incurable cases. Example, cancer, advanced pathology, and turn to allopathy palliation. So sometimes even homeopaths will think, oh, this is really dangerous, and sometimes they will panic and do something rubbish. And even our homeopathic medicine also can come as a allopathic palliation, because what we do might be wrong, or sometimes we will even refer the patient to allopathy. So this is wrong because it hides the real disease picture. So when we do this, when we wrongly palliate, what will happen? It will hide the real disease picture, it will block the action of the vital force, and it will create an artificial disease, drug disease on top of the existing disease. So three things will happen. First one is, it will hide the real disease picture. The real disease is hidden. Second, it will block the action of the vital force. Only if the vital force is energetic, returns back to normal, then only the person will be cured. So it will block the action of the vital force. Thirdly, it creates an artificial drug disease. It will create an artificial drug disease. It doesn't matter what kind of drug it's used. It can be allopathy, it can be homeopathy, any kind of drug. But if we are using it wrongly, that drug disease will be created on top of that existing disease. So two disease will happen. So that's what's caused in confusion. So why palliation is dangerous? So we have to be very careful. All these things can happen. So narcotics, example, opium, morphine, or sedatives like sleeping pills or painkillers, all these things can suppress symptoms and it doesn't heal. So these three things will suppress the symptoms and not heal, and it will block body's natural eliminations and reactions. So naturally our body will eliminate some kind of secretions or some other way of elimination will process, but also reactions also will be done. Sometimes the person will be having diarrhea or such. Even that elimination or reaction to certain medicines or to that disease will be blocked. Then thirdly, it will require a stronger and stronger doses as body becomes dependent. So as we think, like when we think about alcohol or any other narcotics or drugs, when the person is dependent on it, the person will need again and again, and when the person needs again, he will ask for higher dose. I want more because it doesn't work right now. I want more. I want high dose because I don't feel it's working right. So he will be requiring more stronger and stronger doses because the body becomes dependent. And this will cause confusion in symptom picture, making correct prescription impossible. So all these things like mixed and matched, everything like a mixture. So what will happen? The prescription will be difficult, and we will leave the patient in a dull, semi-conscious or worsened state. And finally, all those things like sambar, all those of everything has gone into a very chaos. So what will happen? It will turn into a worsened state. So how to palliate the right way? So okay, H.A.Robert told this should not be done, this should be done. So how to really palliate? You tell me what to do. So using law of similars, that's what H.A.Robert says. We should use law of similars. So even in incurable cases, similar remedies, that is constitutional simillimum, our constitutional medicine. A constitutional medicine means the medicine that shows our correct true picture. So this can relieve suffering gently. It will remove it gently, bring peace without stupefying the patient. And thirdly, it will extend life in a quality way, not just biologically. So we will have a good quality of life. That's more important. Even though it's incurable disease, we should live at peace, isn't it? Even if it's a very short time, we should be in peace. So that peace will be attained when we use law of similars. So for example, a cancer patient had involuntary urination. Her general constitution matched calcarea group. So we got, okay, that person is having a calcarea group of remedy, and now we take the repertory. And now repertory showed options like causticum, pulsatilla, ruxtox, natromyr. So only causticum matched a constitutional type plus urinary symptom. So causticum will be matched with calcarea group, plus it will remove that urinary symptom too. So what will a good physician will do? Will give a 1 dose of causticum 200 and will wait and watch. We'll see how the body reacts. And when he waited and watched, what did happen? It regained the bladder control and general comfort increased. So what is the lesson here? Even in incurable cases, find the remedy that matches both the general state and the dominant troublesome symptom. So by this, when you are following this, you will get the cure. So next is insomnia, a common symptom often palliated. And they will say, I cannot sleep. Maybe there will be many causes of that state. Maybe due to fright, maybe due to grief, or maybe due to some other things. So insomnia should not be treated with sleeping pills. They will say maybe there will be a person who is dependent on sleeping pills. So all these things should be removed. And what does homeopathy? How the homeopath should ask? Why is he awake? First question should be, why you can't sleep? Is there any matter? Is there anything troubling your mind? So why is he awake? Is he cold? Does he fear something will happen if he sleeps? Are thoughts rushing through his mind? Does he fall asleep only after midnight? So the time. Some people will say, till 3 a.m. I can't sleep. But when it reaches 3 a.m. I will sleep. But sometimes till 3 a.m. I will sleep. But later I couldn't sleep. So anything can happen, vice versa. So these details guide to the right remedy, which gives natural sleep plus general well-being. And plus, along with our medicine, we will talk about lifestyle and diet and food also, like kiwi, passion fruit. All these things will help us to get good sleep. Again, our golden milk, so that's also a super boost. So all these things can help. Then pain. Is it a blessing or curse? Pain is not the enemy, but a signal that shows where disease is located, how deeply the vital force is disturbed. Narcotics only hide pain and lead to drug addiction. And the worst part scenario, pain is relieved temporarily, but disease goes deeper and gets more dangerous. So, is it a blessing or curse? So, what does pain will do? It's not the enemy, but a signal that shows. So, when you say, I have pain, that's actually a good sign. Okay, you have pain, wow. But you will not say directly to this patient, wow, you got pain, that's great. But for in your mind, you should say, okay, pain, so I can understand where the disease is located, whether the vital force is deeply disturbed, whether it is just physical or it's deeper inside, whether muscles or nerves is affected. And third, narcotics only hide pain and lead to drug addiction. So when you take narcotics for pain, it will just hide the pain. You will not feel pain. And because you took narcotics, you won't again and again. So it will lead to drug addiction. And the worst part scenario is pain is relieved temporarily, but disease goes deeper and get more dangerous. So if your target is just the pain, then you will just remove the pain, but not the disease. So a true homeopathy respects pain and finds its deeper cause. So it's a blessing or curse? It's a blessing actually. But it's a curse for the patient, but it's a blessing for us because we will be able to identify the disease. Again, opium stupefies the physician more than the patient. Meaning, what does this mean? In H.A.Robert's philosophy, that textbook, it's written like this. What does it mean? So it means giving narcotics might make the doctor feel relieved that he did something, but he's actually hiding the real problem and betraying the patient. So the doctor will be prescribing opium for pain. And the doctor, when he look at that patient, the patient might feel relieved, and the doctor will think, oh, I did something, that patient is getting cured. But actually what is happening, the real problem is actually hidden. And the doctor is actually betraying the patient. Palliation using narcotics suppress symptoms. So when you do palliation, you shouldn't use narcotics. That keep in mind that when you do palliation, you shouldn't use narcotics because narcotics suppress symptoms and confuses the case and creates harm. In incurable cases, the best relief comes from the simlimum, which generally supports the vital force and gives meaningful comfort. So simlimum is really a good option. Pain is a symptom, not a disease. As I told before, pain is a blessing and it's not a curse, it's a symptom and not a disease. It will help us to find the disease. So pain is just one part of the whole disease picture, not the entire problem. The physician must always go deeper. To understand the real cause, you must look at location of pain, type of pain, cutting, dull, stabbing, pressing. For example, the person is having an aching pain. It means that the person is affected with muscles. If there is any kind of lightning pain, it shows that the problem is with the nerves, or needles and pin like sensation, all those shows nerves. So all that kind of type of pain also will help us to understand what kind of pain it refers. Then modality, what makes it better or worse, like movement, cold, touch, and concomitants, other symptoms happening with the pain. All these things should be like location, sensation, modality, and concomitants. That's it. Then example, if a patient says, I have sharp stabbing pain in my left temple that gets worse in the sun and better in open air, this becomes a complete individualized symptom useful for prescribing. So like this, you have to note it. Then alternating symptom groups and periodicity. In that textbook is shown Dr. Jekyll and Dr. Hyde state seasonal changes in symptoms. So the explanation of that sentence is, some patients present different disease in different seasons or time. For example, gastric issues in summer, rheumatism in winter. So all these alternating patterns are part of the case. Ignoring them leads to partial palliation, not cure. So you have to ask about seasonal changes also, like Dr. Jekyll and Mr. Hyde said. You should also identify seasonal changes in symptoms. And if you treat only one phase, example gastric, without considering the alternating rheumatic, you may suppress one part and miss the true totality. So that patient is having gastric issue in summer, rheumatism in winter. You should look for both symptoms in one remedy. Then only you will cure the disease. So danger of partial palliation in curable cases. So what happens that we do partial palliation, like you just give relief only to gastric symptom, or you just give relief to just one symptom, rheumatism. What will happen? What's the danger of this? If a case is curable and you palliate only one phase or one group of symptoms, you obliterate part of the symptom picture. Then you will lose the full understanding of the case and you will risk turning a curable case into an incurable one. So sometimes if you just partially palliate, the whole picture will be changed and it will be very difficult for you to give the next medicine. So what's the lesson that we learn now? Always collect the whole story over time if needed, especially in chronic, alternating or complex cases, just like incurable diseases. Then next one is zigzag prescribing. What is zigzag prescribing? So tomorrow you ask to one of your fellow friend, what is zigzag prescribing? Do you know about zigzag prescribing? Sometimes we have to treat in stages. First treat the most prominent characteristic group, then the next group when it appears, slowly clear the whole case. So what is a warning for the zigzag prescribing? It is not ideal for curable cases. This is only ideal for incurable cases, that is palliation. It's better suited for palliation in incurable states. In curable cases, aim for simlimum, single best remedy based on totality. That is enough. Doesn't need to give just temporary relief. You can give 1 dose or 2 doses to one single remedy and that patient can be healed. So why young physicians struggle in this palliation? Why everyone, young physicians struggle? Young practitioners often struggle to find the right remedy because they do not yet know all remedy pictures deeply and they relied heavily on the repertory. So young physician, obviously they are young, so they are not experienced, so they doesn't know all the remedies by heart, or they doesn't know how that remedy works. So even it's there in the text, we don't know whether it will work or not, isn't it? So they rely heavily on the repertory. So with experience only they will be able to give right medicines. So but the repertory is a great tool to fill in gaps of knowledge. So what you have to do, repertory is actually a great tool. So we can boost our knowledge, help match modalities and peculiar symptoms, and lead to the correct remedy. So what's the teacher's tip here? Study materia medica with personality, generals, modalities, and don't memorize dry list. So when you study with your heart, study with passion, so that you will become a good homeopath. So limits of human knowledge. The law is correct and God-given. So, what does it mean? The law of similars is perfect, but our knowledge is limited. The art is long, but life is short. That's what, isn't it? So, but our knowledge is limited. If we fail to cure, it's not the law's fault, it's not the remedy's fault, it's our failure to study, observe, and understand. So, when you fail to treat a patient, it's not a fault of homeopathic system, but the homeopath, the doctor who treated that patient, because he failed to study when he should have studied. He failed to observe when he should have observed. He failed to understand when he should have understood. So all these things, the law is perfect and God given, but if we fail, that will be seen in our case. So real learning comes from deep case taking, constant study, and experience plus reflection. Constant study doesn't mean that you have to study all the time. When you study with passion. Study by heart, from our heart. So what is trauma, pain, and narcotics versus homeopathy? So what is the difference between them? The homeopathic physician has a group of vulnerary remedies. So in injuries or pain, never rush to narcotics. So in palliation, we shouldn't rush to narcotics. And again, injuries or pain also, we shouldn't rush to narcotics. We have to use our homeopathic medicine. Arnica for shock and bruising. Hypericum for nerve pain, crushed fingers like shocking, lightning like pain. Ledum for punctured wounds. Ruxtox for sprains, aromatic pain. Rota for ligament and tendons. Rota one is really great. And natrum sulph post-injury headaches or trauma to spine. So natrum sulph is a tissue remedy. So when you give all these remedies, you can give a tissue remedy as natrum sulph. So these do much more than painkillers because they will heal tissues, prevent complications, and support the vital force. So even our medicine is also having power to restore the scar tissues to be healed. Again, surgical and post-op pains. So all these pains, okay, we can understand. So in some case scenarios, homeopaths give medicines during surgery or post-op. So even in surgical pain, don't suppress. Find the symptom picture like fear, shock, nausea, sleeplessness, or anything like that. Then give the indicated remedy. Example, aconite for shock after trauma or operation. Phosphorus for fear of surgery and with bleeding. Carboveg for post-surgical collapse. Nux vomica for post-anesthesia irritability plus constipation and gas. Chamomilla for children post-surgery and oversensitivity. So palliative or curative. Never use narcotics, sedatives or hypnotics in curable cases. They suppress. Even in incurable cases, don't assume nothing can be done. Similum can do wonders. So real palliation through similars. Make patient comfortable, restore some vitality, avoid side effects, and honors the integrity of symptoms. So what's the conclusion of this? Summary: don't suppress symptoms, understand them. Palliate through similar, not sedatives. Even pain can guide cure. Palliation through similar means even in incurable diseases, we must not suppress medicines like painkillers, sedatives, and antispasmodics. Instead, we should use a homeopathic remedy that is similar to patient's current symptom picture. This where we relieve patient from the suffering, or we will palliate, but without suppression. Instead, we support the vital force in a gentle, natural way. So what is not palliation through similars? Giving morphine for pain, giving sleeping pills for insomnia, giving antidiarrheals or antacids, etc. They just cover up the symptom and they do nothing to help the patient as a whole. So what is palliation through similars? So now we studied what is not palliation through similars, and here we are going to study what is palliation through similars. Here you take the case fully. You choose a homeopathic remedy that matches the patient's individual symptom. Even if cure is not possible, the remedy helps the person feel relief without blocking the vital force or suppressing the symptoms. For example, as I told, a cancer patient has burning pain, restlessness, and fear of death at night. Allopathy may give morphine, maybe, I don't know. But a homeopath sees the picture and gives R-salb if it's the simillimum. It doesn't mean that the homeopath should give R-salb. If that is the simillimum, then R-salb is given. This is just an example. So the pain reduces, the mind calms, and this is a true palliation through similars. So in Hahnemann's word, the highest ideal of cure is rapid, gentle, and permanent restoration of health, etc. So even if permanent restoration is impossible, we can still give gentle relief, isn't it? By following the law of similars and not suppression. And that's all about this chapter. Thank you for listening. I hope you have understood this chapter. If you have any doubts, please comment below.